MR-guided focused ultrasound is a relatively new technology that uses several techniques that have been around for a number of years to treat tremors, among some other disease processes. MR-guided focused ultrasound is approved by the Food and Drug Administration to treat essential tremor and tremors associated with Parkinson's disease. MR-guided focused ultrasound involves using multiple energy doses by focused ultrasound. The patient who is interested in the procedure and is undergoing it gets to lay inside the MRI machine. His or her head is placed inside a helmet that carries over 1,000 bores, each one delivering a separate ultrasound beam. Each single one of those beams is essentially harmless, but if you focus them all onto the same spot, they can deliver a high enough energy level that can create a small lesion at the area of interest. The beauty of this is that they get to travel through skin and skull without causing any harm and get pinpointed in a very deep area of the brain that's directly visualized on an MRI image, whereby the surgeon can modulate and control the size and the intensity of that lesion. The procedure, while it does require someone to wear a helmet during it, it's painless and it does not require any anesthesia. And in fact, there is no incision at all. The entire procedure is incisionless. Currently, the criteria for someone to be considered to undergo MR-guided focused ultrasound for treatment of tremors includes having refractory tremors, meaning shaking of one side or the other side of the body that's severe enough that interferes with most regular daily activities, is bothersome, and has not responded to non-interventional treatments such as medications, activity modification, and so forth. Typically, the procedure itself takes about an hour, and the setup and the subsequent imaging studies that we take to confirm everything at the end takes an additional hour. So in total, the patient is with us for about 1 to 2 hours. One of the advantages of MR-guided focused ultrasound is the little need for recovery. Most patients are able to return to their normal lifestyle immediately after the procedure. There is now data available from large studies that have followed patients for up to 3 years after treatment. They do suggest that the majority of patients, specifically 60 to 80% of patients, report improvement in their tremors that was worthwhile and resulted in dramatic change in their quality of life. Long-term study data suggest that the results and tremor improvement after MR-guided focused ultrasound persist and they last. With the data that we have at hand, it is safe to say that tremor improvement is seen and is in the order of magnitude of about 60 to 80% in patients, and it does last several years. MR-guided focused ultrasound is currently covered by Medicare and by some private insurance companies. We are able to get approval from most insurance companies with appropriate requests. MR-guided focused ultrasound offers a unique advantage by way of being non-invasive and not requiring any anesthesia. And it offers hope for patients who suffer from debilitating tremors and would have never otherwise undergone a surgical procedure or intervention. In short, this procedure can change the lives of patients who previously had no hope.